welcome to our podcast.
My name's Ashley.
And I'm Lydia.
And so for today, my research topic was the social implications of the opioid epidemic.
Mine was how your socioeconomic status affects your access to health care.
And we're mostly going to be focusing on my topic, but we're going to kind of mix the two together as we go. So this epidemic has come from an increase in the overuse, misuse, abuse, and overdose deaths caused by different drugs that are called opiates or opioids. And those kind of include like heroin, Oxycontin, and fentanyl for the most part. And more than 72,000 Americans died in 2007 regarding some sort of opioid. And the use of these opioids has increased since 2002 and is currently the highest cause of death in the US. So first I'm going to kind of go into the war on drugs because that's kind of where this all started. And I was doing a bunch of research about like where like the racial inequality comes into this. And so originally they started a like campaign or like not really a campaign but like
a
police
movement.
Yeah, like a police like supported event or whatever called Stop and Frisk. So they implemented SWAT teams into communities to kind of try to stop the street use of buying and selling and using drugs. But it realistically just created a target onto Black communities and kind of put a target on their backs because that was the most prominent communities that they were in. So it kind of affected like how everyone in the community was being treated, which is kind of why the war on drugs, like I kind of took it as more of like a war on racism almost. So because of like these norms of like and the increased violence relating to drug activity within these communities caused such a big like uproar. I feel like before the war on drugs can be won and before like this epidemic can end, there needs to be more of a impact on how racism is viewed within drug use as well, because these SWAT teams were just mostly put in to stop the street sales and like street use, which I feel like is a little excessive.
Yeah.
We don't need SWAT teams.
No.
Going into communities. Like some of the articles I read, like some of them were mentioning how it should just be more like police chiefs or police officers being brought to these communities every once in a while, or like when they get a tip or some sort of like something goes on that they need to just kind of like go into. And I feel like this is not only like affecting like those who are using drugs, but also people around them, because now these kids are growing up in what seems now to be unsafe communities. They're being targeted from a young age. They're obviously always going to feel suspicious in some sort of way. And I feel like that's just not what this needs to be addressing. I feel like it needs to be addressing the opioid epidemic, the crisis that is truly at hand, and not just making people feel unsafe, unwelcomed. And I feel like from that, it makes drug use more dangerous because now there's way more higher stakes put at buying, selling, using, like all of that stuff. So I feel like it just kind of creates a more unstable environment for everyone involved.
Exactly.
And then kind of like going off from that, so based on like them targeting those communities, it's also targeting lower social economic status communities as well, because you don't see like them walking through like rich parts of like states where it's all mansions and primarily like white owned. Like you're not gonna see a SWAT team walking around there. So as like we would all assume is, or how it's brought to our attention and how the media portrays it, is that it's a lower socioeconomic status being addressed first, and that they're the ones doing the buying, the selling, the using. I found an article that was published by a national national panel study of income dynamics, and it actually found that higher
socioeconomic status.
Families are actually more affected by drug use, and this is because those parents of those children, because they have higher paying jobs, they have more intense jobs, they're away from home more, which means these kids have no support system at home primarily. They're also like
they're gonna be sneaky.
They're just getting away with anything they
can. They're on their own.
Yes, and because they don't have the family around them, they look for other things to cope, and it turns to substance abuse. So the study had found that there was an increase in like stress and less access to other alternative activities, which then led to related substance abuse. That's been associated with higher socioeconomic status families. And it actually said that smoking was associated with lower socioeconomic statuses. And I would assume that this is because of the cost effectiveness, that probably the substances and that they're abusing as higher socioeconomic statuses are probably a little bit more expensive, a little bit more harder to get. So they have more resources to be able to get them. And then with smoking, it's probably more accessible, cost less, which is why they're getting into it instead. Which is just my little like opinion on how it's becoming available to them more often. And then I think it's funny that we always kind of put like drug use and opioid use along with socioeconomic status.
Yes, so I did my research paper on how your socioeconomic status affects your health care. I think it's pretty commonly known within the healthcare professions how expensive it is, especially in this country. We don't have universal health care. There's Medicaid, there's Medicare, which are government funded, but for the most part, if your job doesn't provide you insurance or coverage or anything like that, you're on your own.
You're on your own
kid, like Taylor Swift sings. So people of lower socioeconomic status have less access to healthcare when they're taking drugs. So if they're taking drugs, if they overdose, they obviously are going to need to get treatment somehow, some way. If they go to an emergency department at a hospital, anything like that, they will not be denied treatment. However, they do have to pay for the treatment eventually, no matter what way. So the emergency department will not deny them the treatment. They will help them, get them what they need, send them off, and send them a very hefty bill for them to find a way to pay. So I thought that was very interesting. It's very sad amongst our country, I feel like. Also, people cannot afford prescription drugs. So that's something necessary too that they can't afford. So I just brought that up. They also cannot afford the care after an overdose. So after an overdose, if you need emergency department care, you get that free. However, you do have to pay for it eventually. If this happens multiple times, people may say, you need rehab, you need help, you need to go somewhere, a facility. They can't pay for it. They can't afford it. They have to be the ones to make that decision. Therefore, they're the ones financially responsible for that decision. They can't do it. They most likely cannot afford it.
No, and that was a big thing that I also looked at with the crisis is the hefty costs of it. And so combining the opioid use disorder along with the fatal opioid overdoses, there's a total of $1.2 trillion of just economic burden that are put upon either the abuser, the family of the abusers, like just anyone related to it. So to kind of break it down a little bit more, for the non-fatal costs, which is like the healthcare, the substance abuse treatments, the criminal justice stuff, the lost productivity, like all of that combined with more like the disorder and like paying for the before care, after care, like all of that, it comes to a total of $470,975, which that's more like an average. It's not the exact cost, but that in itself for anyone is a lot, and that's causing so many people so many issues. And then to kind of go into the fatal costs, which also contains lost productivity, healthcare, and then the value of life that's lost. This is the bigger one. It comes to the total of $500,490. I'm gonna read that again. $549,691 in fatal costs.
Another very expensive cost, though, of an overdose is if you overdose, you're obviously not coherent. You might not be responsive. There's an ambulance ride that you need to take to the emergency department. According to this website, an ambulance ride, uninsured or insured, I don't know exactly, but a ambulance ride is an average of $1,500 out of pocket.
I can't pay for that.
I cannot afford that.
So, and I probably have insurance and it'd probably be a little bit lower.
So if you have a low socioeconomic status, that is a hefty That's a hefty car ride.
Yeah, and especially, like, this could also be put on the abuser, but also think about the families if a loved one were to overdose.
Yeah.
And they could also be lower
Socioeconomic status.
Yeah, I can't speak. I can't say opioid. I can't say that. Sorry about it. Just how my brain doesn't work. But these families are the ones getting affected by that, and most likely they're also probably struggling in some way, and they're probably struggling more with coping with that, of dealing with someone who's stuck down this hard, long road, and paying for that probably is not something they want to be doing.
Yeah. Another thing too, your socioeconomic status, no matter what, like Ashley was saying, people of higher socioeconomic status can also have these issues as well. I think within the media in the past couple of weeks, the past month, Matthew Perry was a really great example of this. We're big Friends fans.
Heartbreaking.
Very sad, cried that night. But he is someone who was so famous, on top of the world, one of the most famous TV shows ever. Had all the money that you could think of, had all these mansions, these expensive cars, could afford anything, and he was addicted to opioids, in particular Vicodin. I read his memoir last year, and he got addicted to it in 1997 after a ski accident, and his colon burst a couple years ago, and he was in a coma for a while. I forget the exact amount of time, but he was in a coma. He was essentially dead for a couple minutes, and he was brought back to life, only for it to be cut short last month. But I think that was a great example of, in the media, someone who is so famous, on top of the world, super, I would never say, he's influential in his own way. Like, Chandler Bing is a very admirable character. But
his show gave him a platform.
Exactly, his show gave him a platform. He wanted to help others who were like him, suffering addiction, and I think that's a good example of showing someone with a high socioeconomic status who struggles with opioids. And he also could afford it. I read in his book that he would pay a guy to get the opioids. He had the money to afford it. He also had the money to afford the care that he needed after all of his incidents. He could pay for the care. He was in rehab multiple times, different facilities. He was in Switzerland, I believe, for a facility because it was supposed to help him. I forget the exact amount. I'm going to look it up. But he spent a ton of money on, I'm going to look it up.
I feel like because being of higher socioeconomic status, you have more accessibility to things because money is really not a question. And then I feel like it's not looked at as much because then they have the money to pay for the cost afterwards. Like, whether it's a family or a son, or the person themselves, they have the money to then pay for the aftercare, the treatment before, the treatment after. Like, I feel like that's why.
In his memoir, it says right here, in his memoir, he said that he estimated around spending $9 million on his addiction. Whether it is a treatment program or the actual pills itself, that is a lot of money that I probably will never see in my life.
No.
So I think that he is a great example of someone who has a very high socioeconomic status and is struggling like so many other people in the world.
Yeah, and I feel like because you're at this higher status, because you're then using substance abuse, you're using it to cope, which is why a lot of children who deal with this are at higher risk for anxiety and depression as well.
Exactly.
Which probably also lies into why, he was also involved in it because he was on top of the world. He had all the money. He had it all.
The money, the fame,
but what does that do for him as a person?
Exactly.
On a personal level? It probably brought him a lot of anxiety with, what do I do? Depression of, everyone loves me, but, I feel so alone.
Exactly.
He didn't have, and that's something that I also talked about is having the support systems. Because I feel like that's when, your family really, gets involved in, what happens from, determines, an overdose versus a disorder.
Exactly.
Because if you have the support, you can get over it, you can get through it. If you don't have the support, then I feel like that's where more overdoses happen because you're missing that support factor.
Yes. I think that's all I have.
I'll bring up one more thing. One thing I found was, even though the families are there for the support, they also need to be reminded, this is not your fault. So, because,
it's a disease.
Someone you're related to this happens to them, it's not your fault that they're involved in this. It's just an unfortunate thing that happens to people that they turn to when they're in their worst moments, and then it just goes off on another road that no one ever planned for it to.
Yes.
So I feel like that kind of goes over everything. Part of like my thesis statement was just talking about the different ways that the social implications of the opioid epidemic are affected, and then saying that this needs to be a war and an epidemic that is won and not lost.
Yes.
Because this has already been going on for so long. Like I said, like a major increase in 2002, which doesn't sound like it was that long ago, but it was.
I was born that year, so
21 years ago almost, or basically. And obviously it's been going on for a lot longer than that. I found research dating back to like the 1990s, like clearly same thing with like Chandler Bang. With Matthew Perry, like it's been an issue for so long, so we need to win this battle.
On it.
We need, as a community and as a country,
yes,
work on this, because it's something anyone can struggle with in their lifetime.
Exactly. It should be a priority.
Yes.
Within the country.
All right. So that's all I have.
That's it.
All right.
We hope you enjoyed.
Thank you so much for listening, and I hope you learned something. Bye.